Dr. B, and I will be taking care of you tonight. So we have some good news that you are ready to go home tomorrow. But we just need to run a few routine checks to make sure everything is okay before we release you. Okay. So I do have your file here. So let me just go through it quickly. Okay. Okay. So this is your prognosis. Okay, let me just check. Okay. Okay. So we have your prognosis and everything is looking great. Okay. So I'm just going to ask you a few questions and you can answer them as honest as possible. There is no right or wrong answer here. Okay. Have you been falling asleep easily or struggling a bit more? Okay. And how has your appetite been? Have you been eating your regular meals? Okay. On a scale of 1 to 10, how has your energy been? So 1 being exhausted and 10 being really energetic. Okay. And have you been able to focus on tasks? Or does your mind perhaps wander a bit? And have you had any moments of worry or panic lately? Okay. And tell me, do you feel safe right now? Okay, so that is all done. So we will move on to your cranial nerve exam. Some checks that we do to make sure your body is still functioning as it should. Okay, but don't worry. The first test that we will be doing is a visual eye test. Okay, so I'm going to move my finger and you just follow with your eyes. Okay. Just follow my finger. Go now a bit closer. Okay. Now I'm going to shine a light just to make sure, just to check your. Okay, so it is a bit bright, so I will try not to shine it directly into your eyes. Okay, so you can just look at the light. Okay. So can you please just close your eyes and open it again? Okay, okay, great. You are doing really great. I just need to write down. Okay. Okay, so this taste might be a little bit uncomfortable. I have this cotton pad and I need to just let it touch your eye. Okay, so just keep your eyes open, and when you slightly feel it, you can just blink. Okay, so I'm gonna start with this one, this side. Okay, and now the other. Okay, there you go. See, that was not so bad. Okay, so next we are going to be doing a smile test. So I'm just gonna present to you two different smiles and you can just tell me if you smile it. Okay, so I do have this is oil. I'm just going to hold it in front of your nose and you just tell me if you do smile it, okay? Okay, good job. And now I have some spray, so I'm just going to spray it and then you tell me if you can smell it, okay? I'm just gonna cover your eyes. Okay, that is perfect. Okay, now we will be doing a skin sensory test. So I have this cotton pad again. So I have a softer side and a harder side. So it should feel different to the touch. So I'm going to just touch some different areas on your face and then you just tell me if it is the soft side or the harder side. Okay, so you need to close your eyes with this one. Okay, okay, that was perfect. So for this one, I just need to put on some gloves. Okay. So I I am going to need to touch your face. Is that okay? Okay. So I'm going to press against your face, and then you can just tell me if you feel the pressure. Okay. So, okay. On this side. Okay, and on the other side. Just going to press along your jawline, okay, and your forehead, and your nose, and your ears. Okay, perfect. Okay, so now we just need to do a quick ear test. So I'm going to make some noises with my hands, okay? And you can just tell me which side you hear. Okay, so you can close your eyes again for this one. Okay, perfect. You did really great. Okay, so we are done with the cranial nerve exam. So now we will be moving on to your physical exam. Okay, so I just need to quickly wipe the equipment before we do get started. Let me just so this is just to make sure that it is clean. It was not used on someone else. It is just a precaution which is standard in this hospital. Okay. Okay, so the first thing I'm going to do is check your heart rate. Okay, so you can just take a deep breath in for me. Okay. I'm just going to listen to the back. Take a deep breath in. Okay. So now I'm just going to check your pupils and how they react to the light. Okay. So you just look Now I'm going to check your ears. Okay. Okay. And now the other side. Okay, perfect. I'm just going to touch your torso and your face a little. Is that okay with you? Okay. So the reason I need to do this is to check how much tension you have in your muscles. Okay. So you can just checking your neck. Okay, and your shoulders. Okay. I'm just going to feel your face. Okay. Okay, now I just need to see if your facial muscle still works as it should. So can you please just clench your jaw for me? Okay, perfect. And lift your eyebrows up. Okay, and smile. Okay, and frown. Okay. And can you just move your head side to side without moving your body? Okay, perfect. And up and down. Great. Okay. So we are all done with the exam. It went really well. It looks absolutely great. I do think you are ready to go home. Okay, so I just need to write in your report patient is stable, calm and responsive. Let me just get my stamp. Okay. So before you drift off to sleep, I just need to give you your injection. Okay. So I do have the video. You can just give me your just clean area. Okay, just hold it there. quick. Okay. So lastly, I'm just going to write your prescription that you can just get at the pharmacy tomorrow when you leave. Okay. So do you need anything specific that I can perhaps write to you? Maybe some pain medication? Okay, you feel fine. That is great. So I'm just going to write your usual prescription. Okay. I will put this in your package that you will be taking out with you tomorrow. And it was really nice meeting you. You are really doing well. You are doing really good. And you will be okay. Okay. And hopefully I won't see you again. And yeah. You sleep well.